So good morning, Walla Walla. This is Dr. Kaminsky with the Walla Walla County Department of Community Health. This is the presentation I presented to the Board of Health today. So we've been showing this heat map for several months, and last week on January the 3rd, when we presented the percent of high transmission counties in the United States was 91%. And we see now that it's that 99% of our counties are high transmission counties. So the US case rate as of January the 5th has risen dramatically. We've surpassed all of our prior case rate peaks. The CDC says that compared to the prior week, the cases have gone up 85%. And variant reports have shown that 95% of the cases are due to Omicron. So the Delta wave is slowly getting extinguished by the Omicron. With regards to hospitalizations around the country, the hospitalizations are up 60%. This graphic shows that they are about to outpace prior hospitalizations. The largest hospitalization prior across the United States was the Alpha wave. This is in the context of an already stressed healthcare system. So this is our biggest concern. And there has been some talk about Omicron being less dangerous than Alpha or Delta, and that's true that the hospitalization rates and death rates are lower. However, because of the rapidity of how quickly these cases rise, we are still getting hospitalizations. So the proportion of people who get hospitalized or die is lower, but because it's happening so quickly in such massive numbers, it is pushing people into the hospital. And as you can see from this slide, that the death rate has increased a little bit. The death rate's up 14% compared to the prior week in the United States. However, this is also likely due to the lingering Delta wave. With regards to Washington State, we have surpassed prior case rate peaks with the Alpha and the Delta variant. This complete data shows a case rate of 882, but if you follow the incomplete data as of around January 5, January 6, the case rate is in the 1300 range. If we look at comparing Eastern and Western Washington, we have noticed that Western Washington has taken off much more briskly than Eastern Washington. If you compare the January 5 date from incomplete data, our Eastern Washington counties on average are 862, and Western Washington counties 1491. This is a case rate ranking in Washington State as of the 7th, I believe, and Walla Walla ranks 21st out of 39 counties. And these are very, very high numbers for Western Washington, 1,800 per 100,000 over 14 days for Pierce County, King County 1,500, Snohomish 1,400. I believe King County, for instance, did not have any case rate peaks higher than around 400 in the past. So this is really dramatic for the west side counties. Also notable is the last time I presented this a week or two ago, there were only maybe 3 out of 18 counties in this list that were eastern counties, and now 7 out of the 17 counties are eastern Washington counties. So we're seeing this spread into the eastern part of the state. Looking at Washington State hospitalizations, as I mentioned before, even though fewer people who get COVID or get the Omicron have to go to the hospital, but because of the sheer number, the hospitalization rate is being driven upward. And this is also, like I said before, in the context of a highly stressed healthcare system. And there are concerns around the state about the effect this will have on hospitalizations, on the health of the hospital system. However, the good news is the death rates continue to trend downward, and some of it could be the fact that Omicron is less deadly, but also therapeutics, and also the fact that we do have some degree of natural immunity in our communities and immunity from vaccinations. Looking at Walla Walla, the 14-day case rate, the up-to-date data on the website as of this morning showed 407 cases per 100,000 over 14 days. But if you follow the extrapolated data here, that value is 862. And based on our internal data from the cases that occurred over the weekend, our case rate is actually about 1,304. So this Omicron wave is definitely in Walla Walla, and and we've seen that with increased testing numbers and illnesses. Luckily, however, we haven't seen a dramatic change in the effect at the hospital. It has ticked up somewhat over the last couple of weeks, but nothing compared to August, September. You may recall in August and September, we had between 20 and 30 COVID cases on the census per day, and the majority of those were in unvaccinated individuals, and then we drifted down to maybe 2 to 5 cases on the census per day, and now we're hovering around 10. The most updated slide we have is from January 7, and there were 12 cases hospitalized. Half of those were unvaccinated individuals. The Southgate Testing Center, we are noting across the country and state and in Walla Walla that testing supplies are becoming an issue. Our testing center last week was only open 3 out of 5 days due to weather. I believe last Thursday that even the testing tent blew down in that windstorm. But even with that, we did do 482 tests last week, and that equals about 160 per day. We're also seeing a delay in the turnaround time for up to 3 days, and we have not heard, but we're inquiring about if there are going to be testing supply shortages or any impact on our community testing center. For now, we're going to continue with our current cadence of 8 to 2 Monday through Friday for the Southgate Testing Center. The turnaround time likely will extend for up to 2 to 3 days. With regards to vaccines, last week through Department of Community Health, we had 6 clinics total. This doesn't include Family Medical Center and the pharmacies and the VA, but the clinics that we had the three Southgate clinics. Last week, we changed the cadence to 3 days per week, and we will continue that cadence for Thursday, Friday, Saturday for a while, and then if demand increases, we will expand capacity. We also had 3 mobile clinics, and out of the total shots, last week we gave 402 total shots, and the majority of these were booster shots. We are still seeing a few numbers of people that are starting to initiate vaccination, which is great. I believe the capacity at Southgate is around 200 to 250 shots per day, and on average at Southgate last week we did about 126 per day. So I think we still have room to expand within those clinics before we add additional days. If we do add additional days, it would likely be weekdays. Talking with Department of Health and our other partners, looking at the rising numbers, looking at the rising hospitalization rates, we possibly are looking at a very calamitous next 6 to 8 weeks. So just an important time just to continue to band together and support each other and encourage each other. And together we will get through this. I would like to make one other point about information. We've had some difficulty getting information over the holidays. And then with the increased volume, getting that up-to-date data has been difficult. So bear with us and we'll work hard to try to get you the information that we have, get it to you as soon as we can. So we will get through this together. Take care.